The date is June 30. This is the news on PBCJ. I'm Simone Absalom. The National Surveillance Unit in the Ministry of Health and Wellness has indicated that 2 new confirmed COVID-19 cases were reported on Monday. The total number of confirmed COVID-19 cases in Jamaica is now 698. At the same time, 1 additional patient has recovered and has been released from isolation, bringing the total number of recoveries to 553. The 2 cases are imported, arriving on flights from the United States of America, 1 male and 1 female, ages 31 and 48 years respectively. Both cases are Jamaicans from St. James and Kingston and St. Andrew. And as for the reports of a backlog on COVID-19 testing, Chief Medical Officer Dr. Jacqueline Mackenzie says her team is already working to rectify the situation.
So at this time, we are having some challenges in terms of our turnaround time. Okay, this is in one due to the large volume of tests that we do have to process. In addition to that, we are experiencing some challenges in terms of supplies for one of our machines, which would have been where we would have had the largest numbers of tests being done. Now, to mitigate this, what we have been doing is that we have recruited other machines to be testing. So we were previously using 1 PCR machine at the National Influenza Center. We are now using 3 or 4 machines there. However, that system is a slower system, so the turnaround time is a little bit longer. In addition to that, we have also recruited 2 PCR machines at the National Public Health Lab that we are using to do testing. But this is the same system as the ones at the university, so it's a bit slower. But in short order, we do expect to get our supplies for our Gov't machine, which is the machine that really puts out the bulk of tests. It is important to note that there is a global demand for supplies, and so we've done a large amount of testing over the last couple of weeks, and so therefore this has put a little bit of stress on the supply chain.
Dr. Mackenzie was speaking at a virtual press conference on Monday at Jamaica House. The worst is yet to come in the COVID-19 pandemic. That warning from the World Health Organization, WHO. WHO Director General Dr. Tedros Ghebreyesus says the virus will infect many people if governments do not double down on testing, tracing, isolation, and quarantine.
And with 10 million cases now and 500,000 deaths, unless we address the problems we have already identified as WHO, the lack of national unity and lack of global solidarity, and the divided world, which is actually helping the virus to spread. As I said in my speech, the worst is yet to come. I'm sorry to say that, but with this kind of environment and condition, we fear the worst. And that's why we have to bring our acts together and fight this dangerous virus together.
More than 10 million cases of the novel coronavirus have been recorded worldwide since it emerged in China late last year. The number of patients who died is now above 500,000. Half of the world's cases have been in the United States and Europe. Researchers in China have discovered a new type of swine flu that is capable of triggering a pandemic. That, according to a study published Monday in the U.S. science journal PNAS. Named G4, it's genetically descended from the H1N1 strain that caused the pandemic in 2009. And according to Chinese universities and China's Center for Disease Control and Prevention, it possesses all essential hallmarks of being highly adapted to infect humans. With Jamaica's COVID-19 recovery rate hovering at around 80% with 123 active cases, the government is continuing to adjust measures to reflect the phased reopening of the country. Prime Minister Andrew Holness outlined some of these adjustments at a virtual press conference on Monday at Jamaica House.
Now, curfews. The day to next day, night to early morning curfews will continue in place, starting now at 11 p.m. on the night of June 30th, 2020 to 5 a.m. July 1, 2020, day to day until 5 a.m. on the morning of July 31st, 2020. Gatherings are not to exceed 20 persons, and this will apply up to July 14th, 2020. In terms of zoos and parks, the opening hours are now 10 a.m. to 4 p.m. for zoos, and for parks, including theme parks, this would be 6 a.m. to 8 p.m. Note that water parks and attractions remain closed.
Mr. Holness also addressed the issue of travel and the testing of tourists that want to enter our shores.
As of July 1, 2020, we will still require testing for controlled entry. However, since the commencement of controlled re-entry on June 1, we now have the benefit of testing for over a month, and we now know the positive rate, 0.7%. Therefore, we can now reconfigure the protocol surrounding controlled entry into Jamaica at our airports. This will allow us to more efficiently utilize our limited resources for testing and surveillance, both for ports and intra-island at our health centers and other health facilities. So all arriving passengers would still be subject to a health screening and risk assessment on arrival at the port of entry. Visitors to Jamaica from areas declared as high risk at this time by the Ministry of Health and Wellness, so areas such as Florida, New York, Arizona, and Texas, those are considered now high risk. So persons registering to visit Jamaica on the Visit Jamaica website, coming from these areas, as of July 1, will be required to upload a valid PCR test, which must be no more than 7 days old from the expected date of their arrival.
The entertainment industry could reopen in July. Prime Minister Andrew Holness says his disaster risk management task force will be discussing the matter this week.
Yes, we will be at our next COVID management meeting, which would be Friday of this week. We will now give some focus to looking at the protocols and some of the proposals and suggestions. This is not an invitation to inundate. We wouldn't be able to examine all the proposals, but we will be looking now seriously at the industry to see how we can see to its reopening in a safe way for everyone. It will take some time. I'm not here telling you that next week or the week after, but at least we will start the process. And just as how we have done with the bars and the churches and other areas that we have opened up, we follow the gradual approach, and we also ensure that it is evidence-based and situationally appropriate. So I want to thank the entertainment community for their patience.
A notice of intention has been issued to suspend the permit awarded to Commander Park Limited, operators of the Dovecot Memorial Park in St. Catherine, for the controversial expansion of the burial site. The notice was issued on Monday by the National Environment and Planning Agency, NEPA, after St. Catherine West Central Member of Parliament, Christopher Tufton, intervened last Wednesday in a long-standing dispute between operators of Dovecot and the residents who had voiced their opposition to the 72-acre expansion. Residents have consistently expressed concern about the safety of underground water systems and dust nuisance associated with the expansion and traffic congestion on St. John's Road on funeral days. The National Blood Transfusion Service is reminding members of the public that all persons wishing to donate blood at any of its facilities must present a government-issued identification. The blood bank and its collection centers remain open for blood donations and welcome walk-in donations. Additionally, donors can make an appointment and pre-register online.
We've been able to offer appointments and pre-registration online for all collection centers island-wide. And this is major because persons want to have the comfort of knowing that if they're coming out of their house, they're coming out for a reason. And if they're coming out of their house, there's no long wait. And if they're coming out of their house, they're going to do something good. And we appreciate all of that collaboration that we've gotten since this COVID-19 pandemic. Our social media handles both on Instagram and on Twitter is the #1 Blood Bank JA.
Persons with disabilities are set to benefit under the Government of Jamaica's CARE program. Executive Director of the JCPD, Dr. Christine Hendricks, says it's a one-off temporary grant as part of government's effort to cushion the economic impact of COVID-19 pandemic. She says the grant is available to persons with disabilities between the age 18 and 65 years who are unemployed or not formally employed. Individuals who have already benefited under the CARE program should not apply. Applications will be open online at www.wecare.gov.jm on July 1. For further information, persons can contact the Jamaica Council for Persons with Disabilities at 876-968-8373 or 968-0623. The dispensation of justice does not have an expiration date. That's the argument from advocacy group Jamaicans for Justice regarding the proposed sexual harassment legislation stipulating that a 6-month limit be placed on complaints brought by victims before the tribunal. Section 25 of the proposed sexual harassment bill sets out that a complaint alleging unlawful conduct must be made within the period of 12 months from the date of the act for it to be considered legitimate by the respective tribunal. The rights group said it has written to members of the Joint Select Committee outlining its reasoning on the issue and a detailed analysis why the amount of time given for reporting sexual matters should be more. Prime Minister Andrew Holness recently visited the families of Constable Dakota Hilton and Corporal Dane Biggs. The officers were killed during an operation in Horizon Park in Spanish Town on June 12.
This is his room.
My son heaven for the God for the last 10 years now.
This is his retreat. His retreat. Exactly the way he left it, 2:45 in the morning.
Only child?
Yes. My only son, only one.
The thing is, he didn't join the force because of wants, out of wants. As we provide everything for him.
So he's still a baby?
Yes, man, still a baby. Make him request what you want to eat him, get him.
Action, man, he love action.
Yeah. On Instagram, you see, we not see, man? Yeah. We love the, to be out there and active and stuff. So I think he really liked that, the challenge. And I mean, it was really brave. I mean, I think how he died was very brave of him as well. So I know that about him for sure. Based on what you see on social media. So definitely.
He's a true lawman.
Yes.
I represented the force.
Yeah.
Oh, since certificate there that
He's a marksman.
Marksman, yes.
So he was SWAT? He was part of your
Training.
He was training. So he's a true hero.
Yep.
Yeah.
My hero.
I used to tell him that, upstairs is yours, and you have to go full of upstairs with picnic. The wife always, mother says, oh, yeah, tell the boy, I said. God, because at this moment I keep on saying to myself, no, I should be really planning to arrange his wedding, not his funeral. We made all the necessary preparation in the event that we should pass. He knows of all our finances and he knows what to do. It was a thinking of burying our son. It should be the other way around. everything put in place. So.
Well, as I said, I'm here to tell you that we are grateful for his service. I obviously didn't know him, like I wouldn't know personally the thousands of other policemen who every day put their lives on the line. But we're grateful for him. So on behalf of the Jamaican people, I'm here to tell you, thanks for letting us have him. Thank you for his service, and to let you know that the entire nation is praying with your family. We are encircling you with love and protection as you grieve in this difficult time. And to let you know as well that if there is any need, any gap to be filled, anything we can do to make it easier, we stand ready at your call and disposal. How are you doing? The hardest part of my job, I find this to be the hardest part of my job, because there's nothing you can say, nothing you can do that can bring back loved ones.
He's a very determined person, very determined. He's very progressive and ambitious, and a homely young man. As it relates to his job, I've never seen anyone so passionate about their job, especially fighting crime. His dream was for Jamaicans to live free. He wanted Jamaicans to be free to, go shopping. They don't have to watch their backs or look over their shoulders. That was his dream for Jamaicans.
We are very grateful. We're very grateful for the life, work, and contribution of Corporal Biggs. From what you have said and from the reports I have received, he is a true hero.
Let's now get the business report from Gabriel Thompson.
In Monday's trading session, the JSE combined index declined by 4,011 points to close at under 400,000 units. Overall market activity resulted from trading in 81 stocks, of which 37 advanced, 36 declined, and 8 traded firm. The junior market index declined by 16 points to close at under 3,000 units. Stocks advanced for 138 Student Living Jamaica, AMG Packaging and Paper, and BARITA Investments Limited. Stocks declined for 1834 Investments Limited, Access Financial Services, and Caribbean Cement Company. Trading firm were Diamond Trading Company Preference Shares, G-West Corporation Limited, and JETCON Corporation Limited. Lumber Depot Limited was the volume leader with over 10 million units, followed by Pulse Investments Limited with 3.2 million units and Trans Jamaican Highway Limited with 2.5 million units. Now for the foreign exchange. The US dollar on Monday, June 29 ended trading at $140.08. The Canadian dollar sold for an average $105.57. The pound sterling traded for $175.46, and the euro ended trading at $161.75. Oil prices slipped on Tuesday amid rising COVID-19 cases and a possible return of Libyan oil production, which has been down to a trickle since the start of the year. Brent crude futures dropped 37 cents to $41.48 a barrel. West Texas Intermediate crude futures fell 45 cents to $39.25 a barrel. And that's it for the business report on PBCJ. I'm Gabrielle Thompson.
In regional news, in Guyana, retrofitting the Liliendal East Coast Demerara facility that once operated as a Ocean View hotel will soon be completed to serve as the new infectious diseases hospital, or what is commonly referred to as the COVID-19 hospital. Kurt Campbell of Newsroom Guyana reports.
The newly overhauled facility will in coming weeks serve all categories of COVID-19 patients, but in the future will be well positioned to control other respiratory and multi-resistance forms of infections. Health officials from the government, along with other stakeholders, toured the revamped facility on Monday and were highly commendable of the transformation. Chief Medical Officer Dr. Shamdu Prasad told reporters that the facility will be ready for operation shortly. No other timelines were given. He said the initial concept is to centralize the care services with regards to coronavirus, and once the world conquers the pandemic, then the facility will look to handle any infectious disease accordingly.
Here in this facility, the plan is to handle at least 3 categories of persons: those who are infected and are suffering from the signs and symptoms of the disease, those who are infected but remain asymptomatic, and those who are in quarantine, who are waiting for their results and, who might have been in contact. And so there are 3 different levels of care that will be offered here.
Dr. Prasad said there are still strict compliance with standard to control the spread of infectious diseases, and noted that the environment is also well suited.
There will always be a role for a facility like this. Even if we were to get out of this pandemic shortly, we'll still have the need for a facility like this to help to, bring control. The environment is suited in that it has the space, but it's also located, in a position where there'll be minimum exposure. It's not like in the case of Georgetown Hospital in the middle of a very highly populated area. There might be residents around, and of course, all the control measures will be in place. The system that the engineers are installing here will ensure that even the air, that is in this facility will be kept clean and free of any form of infection.
Even with the building not yet 100% complete, some 9 COVID-19 patients were weeks ago transferred to the facility and were housed there in an open flat for quarantine and treatment. The patients were subsequently taken back to the Diamond Isolation Facility on the east bank of Demerara. The cost for retrofitting the facility was pegged at $1 billion Guyana dollars. The government has come in for criticism, with some persons not only saying that the US $5 million seemed too much to revamp the facility, but that it would be better spent to upgrade and expand existing health facilities. Under the Acquisition of Lands for Public Purpose Act, the government has signed an order to take full ownership of the Ocean View Hotel back in April. Works to transform the building had commenced prior to that. The acquisition cost is still unknown. Kurt Campbell, Newsroom.
Over in Barbados, a local nephrologist speaks to the indirect impact of COVID-19 on persons with kidney problems. We get more in this ZNS News report.
We've had only one patient that had a cough last week. They went outside, they went to the public health and were tested. They were negative. But then a cough alone is very low risk for having the disease.
Nephrologist Dr. Adrian Sawyer says so far there are no confirmed cases of the coronavirus among persons battling kidney failure in this country. He says he credits this to the effective reinforcement of his team's infection control measures that were heavily influenced by the CDC. In an interview with ZNS News this week, Dr. Sawyer revealed how COVID-19 has indirectly impacted the treatments of patients.
A substantial number of our patients who in fact come for dialysis, they're sponsored by the Public Hospitals Authority. The hospital system have been only doing emergency surgeries. The labs have only been doing what they consider emergencies. It means that we've been affected indirectly in that patients who need routine management decisions have not had them. Some patients who were scheduled to have access surgery, in fact, have not had them because they've been put off.
But Dr. Sawyer says his biggest concern is that COVID-19 may possibly be around for much longer than we think, putting a dent in the opportunity for patients to get a kidney transplant.
The risk is if they get COVID, then they may it may affect their eligibility to get a kidney transplant. And I am aware that there are people who, there's a risk in people who have had kidney transplants. If they get COVID, their outcome and their risk of getting rejection of their kidney, or in fact getting another viral illness that can have adverse effects on them, are higher.
On July 1st, the country's borders are expected to open, and according to Dr. Sawyer, visitors with kidney failure will also be accommodated, but only after they go through a stringent process first.
Like everywhere else, they go through a list of tests that they have to have before they come. And likewise, some of our patients who have to go to the U.S., we have to do certain tests here and send to the units they're going to. Naturally, because the borders have been closed, we've not had to accept anybody here. And because the nature of transfer with transient patients is such that you have to do it weeks in advance, we haven't started that yet.
In sports, the West Indies cricket team will wear Black Lives Matter logos on their shirts during a test series against England starting July 8. The movement recently got global recognition following the alleged death of African-American George Floyd at the hands of U.S. police officers last month. The logo, which has a clenched fist in place of the letter A in the word black, was designed by Watford player Troy Deeney's partner Alicia Hosanna. West Indies captain Jason Holder said the team remained focused on winning the series, but that there are bigger issues to address. And that's the news on PBCJ. Thanks so much for watching.